So how do we treat the fibroids during pregnancy? So there are two things that we need to look for. One is, what are the changes the fibroid will undergo during pregnancy because of the pregnancy, and what are the problems that the pregnancy can have because of the fibroids. So let's start with the changes in the fibroid because of the pregnancy. The first thing is the fibroid can increase in size during pregnancy, which usually happens, and this can be almost double the size of the fibroid when it started with. So if the fibroid to begin with was 3 centimeters, it can become like 6 to 7 centimeters by 9th month of pregnancy. And the second thing is, there is a degeneration which can happen in the fibroid, which is called as red degeneration, where the fibroid undergoes a certain kind of hormone-induced changes, which leads to the pain during pregnancy. And many a times the woman will be confused whether it is labor pain, whether it is related to pregnancy, or whether it is related to the fibroid. If the pain is there at the location of the fibroid, and if it is not intermittent, if it is not like a spasmodic pain, then we usually think that it is because of the fibroid, and we usually manage with painkillers. So coming to the problems caused by the fibroid to the pregnancy. Usually the fibroids don't interfere with the growth of the pregnancy or with the abnormalities in the baby. So this is for sure. So the other things which it can cause is, like if the fibroid is too big and if it is blocking the birth passage, then normal delivery may not be possible. And if it is in the line of the cesarean section, for whatever reason we have planned the cesarean section, then we may have to remove the fibroid and then do the cesarean to deliver the baby. And sometimes if the fibroids are less than, like say 10 centimeters, and if they are easily removable, then it can be done during the cesarean section. But apart from this, like removal of the fibroid during pregnancy is not recommended, and it is not possible also. And very rarely the uterus had to be removed during the cesarean because of huge fibroids, which again, is not very common. There are no cases where the fibroids have changed into a cancerous one during pregnancy, so you can be assured that there is no risk like that. And apart from this, like after delivery, whether it is a normal delivery or a C-section, because of huge fibroids, sometimes the bleeding may be more, and we will have to take care of this post-delivery, where we give them extra medications like injections to control the bleeding. So post this, usually the recovery will be quite smooth, and the fibroids will start shrinking after the delivery, and they will come back to their original size in 6 weeks postpartum. Thank you very much.